Well, hello and welcome to the work-related injuries increasing after COVID-19, all the research that you would need and the answers that you need to make for sure that you can navigate this from an employer perspective. My name is Holly Foxworth. In case we haven't met, I'm a registered nurse. I'm also the marketing manager for content here at Axiom Medical. And we have a fantastic panel today. I think I'm hearing one in the background. Tom, could you mute one of those maybe if you're still connected on both sides?
I'm connected. I can see.
All right. Good deal. All right. Well, we have a fantastic panel that is going to be joining us today. Really a powerhouse, and they come from every different direction. Obviously, there's two faces you're probably familiar with. Dr. Cherry, you see a lot. He's our Chief Medical Officer. You've also seen Tom Gilliam as well. I know that he's been on our platform before, but we also have another new face. And Chris, if I murder your name, just I apologize in the very beginning. But I think we're going to go with Chris Vanderween. Did I make it? Was it close? Partially,
just
maybe?
About there.
Just about there. All right, good deal. Well, I'm going to have them introduce themselves and kind of give you an idea of what their background is. And they each bring very different perspectives and have some additional information about what it is that we're going to go through. And so what we will do first is just kind of go through the information of what it is that we're going to cover. But I did want to bring your attention to what it is that you're looking at here from the webinar platform perspective. So you should see there's several boxes there on the right-hand side of your screen. At the top should be a question and answer box. So if you have a question, for any of the presenters that are here or even just in general, please feel free to communicate with us by utilizing that function. You would just type that into the box, and then we will hopefully be able to incorporate your question within the presentation itself. If not, we may catch it at the end based on the number of questions that we have. The other thing I wanted to bring to your attention was the next webinar event that we're going to have, which is going to be 2 weeks from today. I think that puts us at March 17th. And that would be at 1:00 p.m. For most of you, especially if you have a safety background, I'm sure you're aware that Sleep Awareness Week is going to be coming up. And so we're going to cover that from both perspectives, both the safety concept with Dr. Cherry, which he does an excellent job, and he's always had a passion for this. He has some great information about sleep and how that affects your health, et cetera. But then we're also going to bring in Dr. Les Curte, which is our vice president, or maybe senior vice president, I believe it is, of behavioral health. And so he's going to talk to us from that perspective of insomnia and maybe some things that could be contributing to that. So this is going to be a great event. All you have to do is go ahead and reserve your seat by just pressing that button that says register now. You don't have to enter any additional information, and we look forward to seeing you there. Outside of that, I think that there are some additional resource tools that are listed there on your console. So we'll have a copy of today's slide deck that we'll go through in addition to individual decks from both of our additional presenters. So there's some additional information there along with the COVID risk indicator list, the risk calculator. I think that we also put in there some additional resources that were specific by industry, but you're welcome to anything that's there. If there's something that you're in need of that we don't have that's included, send me a note and then we'll make for sure that we can get that to you. So I think that should be the majority of what I wanted to kind of do in announcements. Let's go ahead and turn it over to our panel. Dr. Cherry, I'll come to you first, and then Chris will come to you next, and then followed by Tom last. Dr. Cherry?
Well, thanks, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background, I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting the military, government, and industrial operations for the past 15 years. And essentially, preventive medicine looks at taking medical science and medical practice and translating it into an effective policies and programs for population health. And I'll turn it over to Chris.
All right.
Thank you for the kind intro. So yeah, a little bit about me. I'm currently Executive Vice President of New Amsterdam Sciences. We're developing compounds to treat inflammatory conditions related to infectious disease and autoimmune conditions. My background, I have more than 10 years experience in infectious disease and health security preparedness, working with several different government clients, including the Department of Defense, Homeland Security, and Health and Human Services. A small snapshot of the work that I've done there. has included everything from developing strategies, plans, CONOPS to harmonize detection and response capabilities to support government and business continuity, but also heavy emphasis on developing medical countermeasures, which include therapeutics, vaccines, and diagnostics to support government stockpiling efforts to respond to both pandemics and deliberate acts of terrorism, whether they involve biological, chemical, radiological, or nuclear weapons.
Awesome. Wow, Chris, that is fantastic. Well, thank you for joining us today. Such a vet and such a diverse background there. And I don't think that we've ever had anybody that's joined us from the research side. I may be wrong, but I don't think that we've had anybody recently. So I am tickled to death that you've been able to join us today, Chris. Thank you for coming. And then Tom, how about you? Would you like to introduce yourself? Tell us a little bit about your organization.
Thank you, Holly. Yep, I'm Tom Gilliam. I have a Ph.D. in exercise physiology. Many years ago, I was tenured at the University of Michigan with an emphasis working on muscle health, muscle physiology. Currently, I have my own business where we do muscular strength testing for industry across the country. And I formed that business back in 1998. And we are with the focus today is what impact the strength of the worker has on musculoskeletal injuries and on overall health.
Awesome. Well, thank you so much for joining us today, Tom. We're thrilled to have you as well. So just to kind of give you an idea of what it is that we're going to be going through today, let's see if we can get this to move forward here. There it is. All right. So in terms of discussion topics, it's going to kind of be a broad range because we're going to kind of go through State of the Nation, talk through. There was some information that came out from OSHA this morning. There was some information recently from CDC, some updates there. So I've asked Dr. Cherry to kind of give us a brief update there. Then we'll get into the difference of what things look like from a pandemic perspective of what we're commonly familiar with at this point, and then what that would look like from an endemic perspective. We'll get into some of the population health research, circle back to the early findings, some of the trends that they're seeing, and Tom has some great information there that we're going to be that he's going to be sharing. The analyzation that they've done on some of their numbers, and then we'll talk about the risk factors, and then wrap it up with some of the fit for duty information on the backside, best practice considerations. So I'm going to come to you first, then Dr. Cherry can kind of talk us through where we currently stand, maybe both from a national level. I think this is all of the U.S., but maybe kind of speak also about globally, since there's been such a focus on that recently, and then also some of the CDC updates that had came out recently with the masking guidelines and recommendations, et cetera.
Sure. So really just taking a comprehensive look at kind of our experience of COVID now over the past couple of years. If we look at this graph here, we kind of have the time or the date time period on the x-axis and hundreds of thousands of cases on the y-axis. And early on, obviously, just a few cases was very alarming. And then we realized that there was going to be just large numbers of cases. But when we look back over the time period, there was really three major surges. And each surge had its own particular kind of character. And I think part of it is seasonality, and other components of it are the variants, the dominant variant at the time. But I'm going to focus on this last surge really because when Omicron hit kind of at the end of last year, we had already experienced kind of a daily case rate up to about 200,000 cases per day at times. And Omicron just significantly increased that several fold, or almost 4 to 6 fold. At the peak of Omicron in January and February, there was approximately 800 to 800,000 plus cases per day. And that went on for a few weeks. And so essentially, you could almost estimate 1 million cases a day, for 14 to 28 days. I mean, that's a huge number of cases. And, CDC has well established that for every documented case, there's probably 3 or so undocumented cases. So, we're talking about perhaps 2.5 million cases a day in a population of just over 300 million, that's really a significant component of the population. And so, today I'm excited about our topic because I think it's very pertinent when we see what Omicron did to our population in the U.S. In many, in all kind of estimates that we've seen, perhaps more of the country has been infected than not. And so from an employee population, we start thinking about how does COVID infection relate to fitness for duty, work-related injuries, et cetera. We've seen some of our clients have reports of higher number of injuries than they had expected in previous months. And, that could be from a number of things, aside from the traditional respiratory and cardiac implications. Just being sedentary while you're ill can really decondition you. And so I know Tom can, help us with some of the perspective there. But also we're seeing some evidence of systemic inflammation that goes on well beyond the symptomatic period of COVID. And so really having Chris here to speak on some of his thoughts on that are really key. And so obviously we have this acute phase of very high level of cases, but what are the medium and long-term lasting effects from COVID? And so that's what's really exciting about our presentation we're going to focus on today.
Yeah, excellent. Well, yeah, you set us up directly so that we can kind of, Chris, I'll come to you next then, and kind of, can you give us an idea of what the difference then, kind of what that criteria would be for the difference between the pandemic state that we are basically kind of accustomed to at this point, unfortunately, versus what that would look from an endemic side. And I think we may even have an example then on the next slide where we kind of make that correlation to flu. But if you go through some of those factors of what it is that determines what state that we're in and what factors would be looked at, that'd be excellent.
Absolutely, sure. So, just for the simple definition of pandemic, that's really referred to generally could be a new virus, or it could be a new variant that is characterized by widespread, rapid disease spread over a large area. The current strains that we've seen so far with the COVID-19 pandemic, I think, are illustrative of that. Endemic refers more to a disease, or it can be disease, or at least an infection level from a virus that's kept at a low burn rate, so to speak. So it's circulating among the population. It generally doesn't doesn't create anything pandemic-wise. Usually there'll be some level of stability and predictability in terms of seasonality, kind of like flu. With COVID-19, just from the way this virus has been behaving, I think the answer to the $64,000 question, I think, here is the disease, the virus, endemic or pandemic. I think it's endemic now, because it's just been so widespread throughout not only the United States but also the rest of the world. And there are a number of factors that I believe that are going to ensure that this virus remains in the population. And you can kind of break them up into three main factors. Factors that are related to the virus, factors that are related to the human host, and then our overall societal behavior aspect. First of all, with the virus, the one thing that's unique about this virus is it's airborne. And because it's airborne, it spreads very easily from person to person. We've seen many cases already over the course of this pandemic where people go into closed indoor spaces, and someone who is positive for COVID is shedding virus, and then their coworkers end up turning positive. Another issue with the virus, because it's the nature of the virus, I'm not going to get too deep in the science here, but what's unique about the virus is it's one of the bigger viruses, but in terms of its replication, its own replication machinery always introduces a fair amount of there's a higher frequency of mutations. Most of those mutations don't mean anything, but over trillions of replication events through millions of people, you're going to end up optimizing a virus that is able to spread and stay in the host. And we've seen that with COVID so far. For example, the original strain and the alpha strain that kicked off the pandemic here in the United States, compared to the Omicron strain or variant is different, particularly in the spike protein. Some of the therapeutics that worked for like Delta and Alpha and Beta and Gamma strains don't work for Omicron because of changes in the spike protein. So the virus is mutating. Another major factor are host factors. I mean, put it bluntly, there's, I would call, insufficient immunity. What we've seen so far is that immunity to coronavirus, either from previous infection or even vaccine-induced immunity, just doesn't last that long. With the vaccine, with people who've had COVID-19, there are cases of people who've been reinfected and gotten sick again. And with the vaccines, we've seen the push for not only the need for a booster, but now there's talk about getting a fourth booster. And, it still remains to be determined why, our immune systems don't maintain immunity for coronavirus. But I think a big part of that is what I just mentioned earlier, is just the virus is changes. Another key thing is, for your clients is, people having pre-existing comorbidities. They're the ones that get hit the hardest. What's been shown of people who have diabetes or who are obese, they're the ones and older age, they're the ones that predominantly end up going to the hospital. And last but not least, there's also societal factors. What we've seen so far in the pandemic, there's been haphazard implementation of public health measures. So we've seen, one place locked down and other places open, but people are completely milling about. And if you don't have uniform implementation, you're going to have non-uniform results, so to speak. And because we have an interconnected world, air travel, you can bring a disease from one part of the world to another. We've seen that with COVID. We saw that with Ebola back in 2014. And then also, I think the biggest factor, in this case, is pandemic fatigue, and people are just tired of it. And they just want to move on with life. And I get that. But we, going forward, we need to be careful just because of the nature of this virus.
For sure. Yeah. You hit on a really good point there. And I think that kind of bringing this back to what does this mean for me and what does this mean for my employee population? So whenever you look at the influenza, and we don't have to get into the weeds very far with this, but do you foresee that long term that's where we may be? How we have the discussions every year, it seems like, of that's a different type of flu shot that we had this year, and is it going to be effective, et cetera? Will it be much like that same scenario, you feel like, long term for the COVID as well?
That's what I envision. Yeah, there's going to be a need to take a COVID or the recommendation to take a COVID vaccine that's updated for the various strains that are at play, or variants that are at play, for sure. For sure.
Yeah. So when we talk about then some of the population health, that's what we get a lot of questions about is okay, we feel like that we're flip-flopping here. We're told one day it's here, we're told the next day that we're better, we're told on one source that we don't have to wear a mask, and then the next one says that we do. And I guess for me personally, and some of the feedback that we get is that it's confusing. People feel like it's confusing, and I get that. And what you touched on before with the information about miscommunication, basically at that higher national level, there's been a lot of that. It feels like that's led to some of this confusion here. I mean, it's a confusing topic as it is, but some of the recommendations definitely make that a little bit harder of a decision. I know, Dr. Sherry, if you have anything you wanted to add, but whenever when we look at long term, before we jump kind of into the injury piece of this and some of the information that we're seeing, do you feel like then that that research is going to continue where we're looking at the surveillance information, some of these different variants. I saw something this morning from, I think Ocean put something out. I believe that the gentleman was talking about some variants that could come out potentially in the summer and maybe winter, and then kind of long term about, is it just ongoing testing and research that we'll continue to do and make some decisions based on that data? Scott, I think you may be muted.
Sorry about that. I wanted to make sure I didn't.
Yeah, you're good. Yeah.
Just a couple of things I wanted to add here was, with this being a novel virus, there was not very much known. And so there was a lot of best efforts before evidence was in place. And then over time, there will be more and more certainty on the evidence on which to make, more better recommendations that are evidence-based. And I think that's part of our conversations today is, we've thought of COVID as kind of this acute respiratory illness, but then we realize there's a host of symptoms that don't really explain a respiratory illness. So we're looking at it as kind of this multi-systemic inflammatory illness, but still in the short acute phase. But now we're seeing long COVID. And so really the discussion is how do we, from my perspective, how I try to help employee health populations is, are folks that have gone through COVID, are they at, how do we manage that the best we can for physically demanding work or safety sensitive work with regards to inflammation perhaps affecting their physical health or even their behavioral health. And so, this has really been evolving but we're in a time where we need to know right now. So it's really tough to have, I think one of the famous military commanders said that, an okay decision now is better than the perfect decision too late. But I think there's a balance to that,
For sure. Yeah. And Chris, I'll kind of come back to you then, maybe when we're talking about some of the inflammatory response. Do you want to kind of talk to us a minute about long COVID and some of the things that you guys are seeing from the research front there?
Yeah, sure. So, what's interesting, as Scott mentioned, there's a lot of research that has been going on with the acute aspect of COVID, and it's an acute aspect of COVID that puts people into the hospitals, particularly into the ICUs and the ventilators. But what's emerging now, there's this new phenomenon called long haul COVID, and what's been seen in many people now is that there's lingering symptoms after the disease, even when the virus has been cleared. But there's some evidence already that there's some underlying inflammation that's taking place. Even the medical and scientific community, we're still wrapping our heads around trying to understand, what is long haul COVID. To put it simply, it's really comes down to a multi-system sequela, different organ systems that are involved. If you think of, here's a good analogy that I like to tell people. So like when you go to a hotel, they give you a card to get access to your room, right? So virus and cell interactions are just like that, one key, one room. The thing with the virus that causes COVID-19 is like the general manager of the hotel who has the card to get into every room. And so the virus can get into every compartment. And so when you have infection in the different organ compartments, you get residual inflammation and damage. And so we've seen people with neurological damage. You've heard of the brain fog, people having migraines. One thing that's really of concern is some people develop a condition called dysautonomia, which is a dysfunction of the autonomic nervous system, which controls your breathing, your blood pressure, and your heart rate. And some of those people end up having abnormally high heart rates or shortness of breath, 1 year on, even though they have no evidence of lung damage. There's cardiovascular damage, myocarditis, heart inflammation. People are having thromboses, development of strokes. People who survive severe COVID-19 disease, who end up having permanent lung damage, develop a condition called pulmonary fibrosis, and that leads to less oxygen in your body and also reduces your lifespan. There's no doubt about that. Also, there's general symptoms, fevers, malaise, fatigue that can persist on for months to even to a year or 2 years now. I was actually on the phone yesterday with someone who told me his dermatologist has long haul COVID. It's been out for 2 years now. But again,
wow.
Chris, could I ask you real quick?
Sure.
I think with traditional respiratory viruses like flu and maybe even the traditional colds, which are also caused by different forms of coronavirus, we think in the sense that the symptoms of the respiratory tract are a direct result of those cells being directly infected by the virus. Could you maybe shed some light on why you think that there's now this multi-system, impact besides the respiratory system, all these other systems? Is it, you gave us the analogy of kind of, the COVID has this master key, but is it because the virus can become, or the spike protein can be in your system and then affect multiple cells aside from the respiratory tract? Is that what's happening, or do you have any insight into that?
Yeah, absolutely. So there's a receptor called ACE2 that the virus binds, and so that receptor is present on all all blood vessels and almost all cell types. And right there, it has the key to the kingdom, so to speak. Whereas other coronaviruses and other let's say flu viruses, they use different receptors, and different cell types have those different receptors. So by being
that's
using
really
the hotel
helpful.
analogy again, being having the general manager's key.
When I was doing primary care, we heard of a blood pressure medicine called ACE2 inhibitors, which really affect the kidney. So when I first heard coronavirus affecting or interacting with ACE receptors, I thought of the kidney. But then as I looked into it more, like you said, these ACE receptors are really everywhere. And so it's really very impressive, not in a great way, but just from a scientific perspective. So thanks for sharing that.
Yeah, absolutely.
Yeah, no, it's interesting, and I think just to keep things in numbers, the case counts for long haul are growing. Here in the USA, based on 10 to 30% of people who get infected with the virus, and and this doesn't have to be a severe infection. There are people who've been infected that have asymptomatic conditions or a mild disease, end up developing long haul later down the line. And so, just in the USA alone, we have anywhere from 8 to 24 million cases. And globally, that's bigger. And of course, those populations are going to be growing and will be growing as long as SARS-CoV-2 is still floating around endemically.
So I think it sounds like that we should, in saying that COVID is not going away, it feels like that would probably be a safe answer then to answer the question. Then would you agree with that, Chris? Doesn't look like we're done yet.
I hate to sound like a boogeyman, but but just kind of looking at it from the scientific standpoint, that's what we're looking at.
Yeah. Well, before I move on to Tom, I'm headed your way next, but just to kind of steer the boat a little bit to a different side here. One of the things that really jumped out at me whenever we were seeing these uptick in injury numbers was there's some other things that must be going on here, because we're seeing that there's a significant difference in what is occurring, and there has to be some type of relationship, whether it's, I don't know that any of us would say that we felt comfortable to say that it was directly because of COVID, but it does see that when we're looking at it from a conditioning perspective, that there's risk for injury because we haven't been using our bodies in the same way that we were used to. And so, in preparation of coming to you, Tom, and I'll look for your kind of insight here, but whenever we were pulling up some of the information, there was 3 numbers that really jumped out at me whenever you look at these sports leagues. And so we had like the NFL, and they were talking about that after after the lockdown that they previously had, that they would normally have like eight tendon ruptures a year, and all of a sudden then they returned to training camp and they had 10 in just the first 12 days of that training camp. And then you went over to the German football, and they were saying that they were seeing a significant increase, almost like 230% of their soft tissue injuries that were increasing in a 2-week time period. Then you step over to the minor league baseball, Major League Baseball, and you saw that even though they had a shorter season, that they had like a 30% increase there as well. Mm-hmm. And so while we can't make a direct correlation that, hey, you had COVID, and so this means that you're going to have this injury, it does look like that there's a significant piece of this that has to do with the conditioning factors. Has your group looked at that, Tom? And what could you kind of give us an idea of what maybe some of the data that you guys have looked at and what the high points would be there? Sure.
And going back to the professional athletic teams, what we don't know during that period of time is how physically inactive were the athletes. Did they work to stay in shape? And then maybe there was not enough time given to their training when they brought them back from the lockdown, or from the time when they could not play their sport, how much time was given to them in terms of training. Because one thing we don't know is how much time does the industrial athlete need when he or she gets the COVID? Do they need to get back when they come back to work in terms of being ready to come back to full time and do what they were doing prior to the COVID itself? What we have seen, Holly, we monitor physical strength in the upper body and the lower body, and I've been doing that for many, many years. I had the opportunity to look at about 20,000 workers in 2019 prior to COVID, and then about another 20,000 in 2021, just right after COVID, with 2020 being, of course, the time when there was the lockdown. Well, let's go back to the previous slide if you can for a second. But what we see is a dramatic decrease in shoulder strength and knee strength. Now, typically, that's based on just 1 year of the lockdown. Typically, we see about a 1% decrease each year, but now we saw 5%. We saw a 3-pound weight gain. Normally, we see a half-pound weight gain on an annualized basis with the worker, and we saw a 6% decrease in that strength to body weight ratio, which we'll talk about in just a moment. That's a critical measure in terms of injury prevention, particularly soft tissue injuries. And then we also saw a large number of people jumping into that morbid category of BMI of 40 or more, and typically that's right around 4 or 5%. So we've seen a tremendous increase in factors that will impact not only the health of the worker, but make them more susceptible to injury, particularly the musculoskeletal injuries. And if you have an aging workforce to begin with, which a lot of companies have, we also know that the loss of muscular strength leads to, with the older worker, more slips and falls, for an example.
Tom, could I ask you real quick before we move slides? When I met you, I think back in 2018 or 19, you presented some amazing data to me that you looked at population health, strength, and BMI metrics over the decades. And so I think what I gleaned from that was that you said that there was significant degradation in strength over the decades, as well as body weight increase. So what you're presenting today, is that a worsening on top of those effects that you reported back in 2018?
Yeah, that 1 year of lockdown where a lot of companies shut down, or they laid off people, or they were slow to come back, that time frame, all the accelerated the loss of strength, the weight gain, the decrease in the strength to body weight ratio, extreme morbid obesity people by about 5-fold. So that 1 year did more damage than what we saw over a period of about 15 years.
Wow. Say that one more time, Tom, that last statement that you just made. The damage that we saw over that 1 year time frame.
Can you say that one more time? Almost equal to or greater than what we saw over the last 15 years from 2005 to 2019.
Wow.
And so I think what's happening is that it's inevitable that there's going to be an increase in musculoskeletal injuries with time, because we don't know how long this is going to take to correct itself. You know, how many people after being locked down and being physically inactive for a period of time. And, you know, Dr. Salas's research that came out about 6-7 months ago, where he looked at 48,000 Kaiser Permanente workers out in California, said that physical inactivity was the worst risk factor as far as severe COVID was concerned. The people who were the most physically inactive had the greater rate of being on ventilators, had the severe COVID, were in the intensive care units, and even had a greater risk for dying. And as a result, it's a little bit late, but the CDC just recently announced that physical inactivity is now a risk factor for COVID. So what does that mean? Well, if we can become more physically active, particularly in the industrial environment, because what does that do? Besides getting stronger, the critical thing is to improve and enhance your immune system. Physical inactivity really puts your immune system at a great disadvantage, which goes along with what Chris has been saying, that increases your risk for COVID.
You know, what this really speaks to me strongly is, you know, for employers out there that have heavy or very heavy physical demands for their employees who may be working at or maybe even over their physical capability, especially if they're not doing the type of assessment that you provide with the isokinetic, or if they're doing even functional capacity evaluations. But again, if someone is working at or above their level, frequently they're at high risk for injury. And then so if they have kind of this degradation over the years pre-COVID, they're going to become at higher risk over time, because we all are losing strength over the years unless we're maintaining it. But if someone is out for COVID, I mean, I think they're at extreme or very high risk of injury because of this deconditioning effect that we can draw from I think what's publicized in the more professional sports team, because they have such visibility. But it's very medically plausible that this is a concern that, you know, everyone's thinking about severe COVID from a hospitalization, but, you know, again, most cases are not severe, but they can still be significantly impactful to the employed populations.
Well,
absolutely.
And as you know, particularly with the professional football players and NCAA college football players, they track many of them, and these are well-conditioned athletes. And they all had mild cases, and it was about, depending on which study you read, between 1% and 3% of those people who got mild cases of COVID ended up with myocarditis. And it didn't happen necessarily immediately after coming back from the COVID, but it happened anywhere from several weeks to several months to 6 months later. And industry's got to worry about that. When that worker comes back from COVID, you know, it may be 6 months after coming back to work that all of a sudden you see signs and symptoms of this worker may have myocarditis, and we're still dealing with that today.
Yep, absolutely.
Wow. Well, kind of looking at it, and we don't have to dig into all of them, but I know that your team does a lot of research, Tom, and just kind of putting a dollar amount on this, it definitely kind of raises some eyebrows in terms of what we're looking at here, and what, if you haven't felt it yet, get ready.
Sure. Holly, what this slide is basically saying is that we've studied for 20 years now strength to body weight ratio, and we've known a lot about strength to body weight ratio all through athletics for many, many years, so this is not new. But we know that people who have a high or strength to body weight ratio score, that means they have good, healthy muscle mass relative to their body weight. They perform better. They're safer workers. They have fewer injuries, and they have fewer medical claims. What this slide shows is that those workers who have a high strength to body weight ratio score, they're out here in the fourth quartile, out here to the far right, that their medical claims are approximately 41% less than those who have a very low strength to body weight ratio, meaning their strength is not proportionate to their body weight, which puts them at greater risk for injury and for greater risk for disease. So whether you express it as a average claim cost or per employee per month, this represents about 30,000 industrial workers that we've been tracking, and we see that. And of course,
Wow.
one thing about strength and body weight ratio, those are two things you can impact. One is strength. You can gain strength at any time in your lifespan. American College of Sports Medicine, they're doing research on 90 and 95-year-olds, and they're getting stronger as a result of weightlifting programs. And so it doesn't make any difference whether you're 20 years of age or 60, 70 years of age. We can get stronger. And for the most part, with few exceptions, we can also do a better job managing our body weight. Those two things really contribute to injury prevention and risk management.
Wow. Great information, Tom. That's fantastic. Whenever we talk about whenever you're looking at some of these issues, and we mentioned the mental health or the behavioral health piece of this well, Cherry, and it even ties into what we were talking about some of the sleep stuff that we'll cover in the next event. But talk us through then kind of what some of those safety dangers could be, Dr. Cherry, for if we have some of the not only physical inabilities, but also we have some cognitive impairment that could be going on. What would that look like, and what should we anticipate there?
Yeah, no, thanks. As Chris spoke about, really COVID can manifest not just as a respiratory disease, but really as a whole body disease because of that ACE2 receptor being on so many organ systems. And then I also believe you spoke to it being part of the vasculature, the blood vessels. So, our whole body is vascularized, and that's how we, get nutrients and oxygen. So essentially, COVID has access to really all of our main organ systems. And so this is a great pictorial here that shows, not only is it physical, but also behavioral and cognitively. Obviously this has been such a challenging disease for everyone, but for me personally, once I saw all the different types of symptoms that we were screening for based on kind of that first World Health Organization's report out of Wuhan, it really had me bewildered. But I think now I have a better understanding from the pathophysiology or what's actually causing these symptoms. But from a pragmatic perspective, really, if someone is doing physically demanding work, we need to be concerned about their physical health. Most physically demanding work is safety sensitive, even if it's not formally considered safety sensitive. But especially for those doing safety sensitive work like truck drivers, forklift operators, operating other machinery, working at heights, you could almost consider COVID infection or long haul COVID almost a potential impairment similar to what you would find with sleep deprivation, illness, illicit and illicit substances. And so, decision making, I think I've seen studies that look at, is a new worker more likely to get injured than an experienced worker? And when I was doing a lot of workers' comp research, it was interesting because new workers seem to get injured more often, but more experienced workers, when they did get injured, they got injured more severely. And it could be a function of a confounder of age, but it could be that if a more experienced worker did something wrong, it was really bad. But in general, I think we need to kind of, and I think, Tom, you put it really succinctly and efficiently, is to manage risk for our safety and HR folks in the audience. Really, COVID is something that's not just in the acute phase for short-term disability or just absence, but it can affect productivity and maybe even safety. And so, again, I think the big thing in front of us is acute COVID, but we need to be thinking now of chronic long-haul COVID as well.
Yeah. Just kind of looking at it from that aspect then. So we had talked about some of the things that you could do that would be impacting your recovery, since we're also seeing, somewhat of an expanded time period of if your employee is injured, why are we seeing different results? Why aren't we having the same results of what we did initially pre-COVID, and seeing that, normally if I have a sprain strain type of injury, it takes this type of time period to heal, and we're seeing that it's falling outside of that. So talk us through then some of these things that could be causing some of those changes that we're seeing in the expanded duration of the recovery period.
Yeah, and as Chris spoke to, there are very classic vulnerable populations for severe disease or more impact to their quality of life and activities of daily living. And so your general health status really is a factor. And so if you have chronic medical conditions, especially if they're not well controlled, or if you're not even aware of them, if you haven't had a physical in the last year, the last 5 years or 10 years, that is something I think we've kind of pushed a little bit, is if you haven't gotten a physical, go ahead, because if you have medical conditions that you can start treating and improving, it's going to drastically help. And then as Tom spoke about, your physical fitness level is absolutely critical. I know when I work out more, I can do more steps before I get super short of breath. And then when I stop exercising, I get comically short of breath. But imagine if you're getting comically short of breath just with a few steps, and then you get a COVID infection that takes out 30 to 50% of your respiratory capacity. You know, you want to have as much reserve as possible. And so, so I think it's your personal factors that can really dramatically impact that. But, I think what's happened to a lot of people is they've been guarded to seek medical care because they know that's where all the sick people are. And that was the case with pre-COVID, I think. I think my grandparents would talk about, oh, Scott, I'll never go to the hospital because that's where people go to die. And so, obviously there's wisdom there, and it's kind of a cliche, but I do tell people now, when you get COVID, as soon as you start getting short of breath, you really need to quickly get medical care, because there's this folding, Chris used this word sequela, but it's kind of like an ounce of prevention is better than a pound of cure. So if you can get in quite early with early symptoms, especially now with all the therapeutics out there, it prevents that damage to your lungs or to other organ systems. And then I think, from a correlation perspective, not necessarily a causative perspective, your mental and behavioral health status is so important. If you're struggling with mental and behavioral health pre-COVID, you probably will not do as well post-COVID. And I think there was some studies that showed, and it was a correlation study, of course, it wasn't a causative, but it looked like anxiety and depression for ICU patients were highly correlated. It was actually a predictor. And so I think there's been a lot of fear-based kind of information given out. And I think that hasn't helped the general public. For us, like in the field, it's actually affected me too. And I try to feel that I can insulate myself a little bit, but, watching the news every day and reading the studies, it does definitely wears on you. So you want to have the best mental and behavioral health as possible. So, obviously we are focusing on that dramatically at Axiom, but it's really just crucial whether you're an employee, stay at home, or, not yet working. If you're young, really your behavioral health is absolutely critical.
Absolutely. Yeah, significant difference on your recovery period. And, just kind of an additional point that I know that we've talked about before, Dr. Cherry had shared, but, we saw that those big spikes in increase in substance abuse whenever that was occurring when we're all at home. And so we saw the alcohol sales go up. We saw the substance abuse, the positivity rates that were going up in those that were abusing substances. So I think that definitely could have an impact there on some of the things that had occurred, not to mention just even the lack of treatment because the services were limited. So if we kind of look then at a broader view of what the implications would be of the employer as we're kind of wrapping up in these last few slides here, talk us through what that would look like. I mean, are we talking that, we need to look at both physical issues of capability from a risk factor, and then also looking at illness, preventing illness, and how you manage that piece? Or what types of changes do you think that we're going to see? And everybody's welcome to jump in, anybody that wants to contribute. Yeah.
Well, I'll just make some quick, broad comments. I think our clients and then our audience are really professional risk managers when it comes to health and safety already. And so this is just an awareness piece that can start priming and seeding thoughts about how would I start putting together some risk management tools for this, because we do feel we feel it's imperative that, there is this increased risk for injury, absences, healthcare cost, potential government regulation. We've seen some of that happening, going back and forth. But, whether you're in human resources or safety or operations, you kind of have a spot that you're going to focus on here. But really, there's, I think, I don't want to say low-hanging fruit, but there's going to be, because COVID is so prevalent and it's going to be endemic most likely, I think if you can start thinking about this now, there's value to be had. That's what I call a win-win-win. It's the right thing to do for the employee. It's the right thing for the employer. There's going to be value from effectively managing healthcare costs, absences, preventing injury. But it's also a win for society, because at some point early in this pandemic, I was concerned that our critical infrastructure companies and institutions were going to be shut down based on the pandemic. And so obviously that was very concerning. So anyway, I'll hold it there and let kind of our panel talk on any aspects they feel is important.
Well, my contribution there, and Scott, is the fact that I think what we've learned is that we need to go back to what we've been talking about for the last 60 years. We need to make sure that our worker is encouraged to have a physical, active lifestyle. Doesn't mean you have to go to the gym every day, but just being physically active has shown, and COVID has brought this to the front of the burner, that those who are physically active, again, have a better immune system, can better fight off viruses, not just COVID, for an example, and that you want to maintain that healthy immune system going forward, because you never know when another pandemic will hit and a different kind of virus will hit and that kind of thing. So I would encourage industry to get more involved in what they can do to have their employees become more physically active, and also have healthier nutritional habits, because we know both of those things contribute to a healthier immune system, and that's our best defense against these types of viruses going forward.
For sure, yeah. Tom, while you're on that, one of the guys that had spoken up here was asking about, what type of systems do you feel like that should be put in place? Nick was asking about what type of systems or monitoring that you think should be in place from that physical aspect of them physically returning to the workplace. Are you thinking then like screening tools? Are you thinking physical assessments? What are your thoughts there?
Well, the best thing to do something ongoing, and the laws make that very difficult to do. You can't mandate ongoing screenings. You can make it part of a benefit package where it's tied into, perhaps if you do A, B, and C, you'll have a lower deductible. If you can show improvement in your health, you'll have a lower deductible. And there are ways to assess that. You can assess that through muscular strength training programs like we have, for an example, or ongoing wellness programs where you can monitor what's happening to body weight, to blood pressure, and things of that sort. So it's difficult in industry, Holly, as much as I would like to see all industry get more involved with offering strength training, physical activity programs, better nutritional programs for their employees. It's just too hard to do it in a plant environment. You might be able to do it in an office environment, but in a plant environment, the ones I've been in, it's just too difficult. And so I think what industry's role is to educate the workforce as to why they want to become more physically active, and talk to them about all the benefits, which includes things like Scott was talking about earlier. Even mental health is tied into people who are more physically active have a better mental health aspect. In terms of sleep, they sleep better and things. There's so many benefits to the being physically active other than injury prevention.
Right. Yeah. Yeah. Good point. And Chris, I was going to ask you, I saw that we also had a comment that was in there that was asking about whether there could be, in terms of long haul COVID, Deborah was asking, could we see that there could be a risk of Alzheimer's? So maybe some dementia effects or things of that sort. Has your team looked at that? Are you aware of any information? That was a great question, Deborah.
That's a great question. I think the truth is, I think the jury's still out. But the fact is that residual brain inflammation can contribite to dementia, and it's kind of hard to tease out because we have, as Tom mentioned, we have an aging population. So, I mean, the risk factor is going up there. But I think what's going to be interesting is to see in the coming years if the incidence of Alzheimer's or dementia-related diseases emerge earlier than what would normal, let's say, be for people, let's say, pre-COVID. That's going to be interesting. Just to kind of echo what Tom was saying, the best thing to do is to absolutely educate your workers. I mean, if you can get yourself in a much physically healthier state, you'll stand to be much better. And then in terms of, I think a lot of people, we know, I think it's fair to say that we know healthcare costs are going to go up, but I don't think people really have an idea of what that number means. But just to give you an example, so someone who goes into the hospital for acute COVID, goes in the ICU, gets put on the ventilator, the average hospital stay in the United States is about $300,000. Some states are a little bit lower, some states are a bit higher. I've seen figures going up to $1 million or $500,000 or more. You come out of the hospital, let's say, with lung injury, let's say pulmonary fibrosis. Now you got to take a drug like Ofev or Esbriet, which treat the disease, but they don't reverse it. Those drugs cost about $100,000 a year. And so right now, I mentioned $300,000 average ICU stay, and then $300,000, let's say, over 3 years of treatment. Right there, you're more than $500,000. And then, of course, for other long haul conditions, as this condition lasts, we don't know what the healthcare costs are going to be, but I would imagine, as Scott mentioned, we're all in this together. There's going to be a societal impact to that, and the government's going to we'll have to address that somehow. You can't get around it.
Completely agree. Several things I wanted to kind of circle back to before we wrap up. I know we're running short on time here, kind of at the end, but we did see a question or a comment that came in from Janet that was talking about, most of the insurance companies don't offer free or discounted gym memberships, and so the question between what she had said and then also what Vincent had said was saying that, that he liked the idea of tying back the wellness into a benefit for that employee. There has always felt like that there's been a little bit of resistance. It's like everybody wants to talk about wellness, but it does cost money. And so it's sometimes it's hard to implement some of those types of programs. Do you think that we may have a larger audience that's more willing to hear that argument at this point now that we have reached this degree of illness and long-term outcomes that have occurred?
I absolutely. I think that there's more interest with the insurance carrier, the benefit companies, to get involved with being proactive with prevention. And I see more and more companies having incentives set aside with programs that if you can achieve a healthier body weight, if you can achieve a greater muscular strength, or at least maintain it and not lose it with age, that they're tying health benefits into that with a lower deductible. And we have several clients now doing that. I think these benefit companies are becoming more and more creative. They're a little bit, running late on that, but I think the COVID has really opened their eyes to what they need to be doing from a prevention point of view.
Absolutely.
Yeah, I agree. Yeah, did you have something, were you saying something, Chris? I'm sorry.
No, I concur everything that makes complete sense. I mean, I think that's, from a personal, health perspective, that's the easiest thing, that's directly in your control to be able to, get yourself back into physical shape. And then, to layer that on top, irrespective of personal views on vaccines, the data so far shows that they're protective, and to take that. I know some people prefer looking at therapeutics, but the thing is, therapeutics are used to treat an active disease, and that's the idea here is we don't want to get to that stage, and if we can blunt the disease in the early stage, that has a good potential to blunt off the long-term consequences.
Absolutely. Well, guys, we are right here at the end of time, and so I'm going to wrap up here. I think we had some additional questions. We will provide we'll send you not only a link to this presentation that you can watch again or share, but if you want to download, just to reiterate, there is a copy of this slide deck along with the slide decks that of information, a larger amount of information that came from Tom and Chris both. Both of those are right there in that resource section down at the bottom of your screen on the right-hand side. So you're welcome to access that. You can just print it out and have that information for yourself as well, especially some of that information about the financial impact and then also the injury stats. So if we didn't get to your question, we will follow up with you individually. But I thank all three of you for joining us today. It was an excellent conversation. I think it sounds like that we are just getting started in terms of realizing that while we may be in this section where we feel a little bit safer from pandemic perspective, that we're going to see some long-term implications that are associated with this. So we definitely have to have our eyes on, have our glasses on, and really taking a look and make sure that we're focused on what is there for the long-term on the radar there. So anyways, well, thank you all for coming. I appreciate it. And we will see you next time. And if you didn't already, make sure that you click that button on the register now for the next event. Thank you all. Bye-bye.
Thank you.
Thank you. Thank you. Bye-bye.